The most important aspect of using regenerative medicine therapies is having a very honest and frank conversation with the patient about the likelihood that they're going to improve whatever condition that they're having. We've seen that these therapies have the ability to significantly improve pain and function in a lot of different ailments for patients, but there are certainly some ailments that it's not indicated for. And there are also some patients that don't respond well to these therapies for a number of different reasons. I think most importantly, when you talk to your practitioner about using regenerative medicine therapies, they have a very frank and honest conversation with you about the likelihood that it's going to improve your ailment, and then also what the evidence base is for the type of ailment that you have. And those honest, frank conversations really allow the patient to make the best decision about their care. The reason why that's important, particularly in this field of medicine, the regenerative medicine field, is that these therapies currently are not covered by insurance companies, which means that the patient is paying out of pocket for the cost of the procedure. And they can be quite expensive, depending on what type of procedure that you opt to get. The good thing is that a lot of the types of procedures that we're doing, the devices we use for those procedures are what we call FDA cleared, which means that the device has been deemed that it is able to be used to create the product that we're using for the regenerative medicine therapy. That is different than being FDA approved, which it means that the therapy is definitely going to improve whatever ailment that you have. Again, there's still a significant amount of research needs to be done in this area to see exactly the conditions that are most benefited by this procedure, but we have done quite a bit of evidence-based research now that suggests that there are a number of ailments that do improve with these therapies. Again, the most important aspect of this is have a conversation with the patient so that they understand, one, the likelihood their condition is going to be improved, also the cost, and then the potential outcomes for the procedure.